Okay, I'm going to explain how to treat low back pain. First, I'm going to show where you focus on treatment when you treat low back pain. There are two checkpoints for low back pain in terms of local alignment: sacroiliac joint, SI joints, and lumbar spine. For SI joint, you check the area in terms of tightness and tenderness. Okay, the first point is SI joint, sacroiliac joint. And when you palpate the low back pain, there's a bump here. So you palpate in this area, you find kind of bone sticking out, which is called PSS-IS. And SI joint goes in this area, below PSIS, this area. And if you palpate, you feel kind of cliff. So SI joint goes here, actually it's below here. And you palpate, first you palpate the tightness. And here I feel tightness here. And at the other side, if I palpate, I feel tightness here. And first it's good to compare both sides and which side is tighter. And you can ask the patient which side is more tender, and locate that targeting point that you want to treat. So the idea of treatment is to loosen up the tightness that increase the movement of the SI joint. That's first point. Now I'm going to demonstrate how to palpate and treat the lumbar spine area. There are two ways for palpation: looking for the tightness in directions and scanning the surface of the skin. And the second point is lumbar spine. The vertebrates in the lumbar area. And same, likewise, you palpate along the spine and find tight spot. And if you tightness here, and you palpate along the spine, feel tightness here. Or you can palpate lightly the surface, and if there's any tension in the skin, that point can be also a treatment point. I feel tension here, and this side actually better. Some tension here. So far I find some tight spots, and I'm going to treat that. I'm going to show you two ways for treatment in this video: Shiatsu, Japanese style manual pressure, and acupuncture, needle therapy. And for treating low back pain, you can use your finger or you can use needle. At first, I'm going to show how I use my finger. Do you look at the tightness before treatment? It's like this, looks like this, the tension. Then I'm going to treat. And here it's very important to loosen up your whole body. The posture is important. I'm going to focus on treatment here. Just look at how I do. Now I'm getting connected to the patient. Okay, I adjust my fingertip to connect the patient. And I feel under my finger, the patient's body muscle is moving, which means it's loosening up. And with this connection, I even focus on loosening up my whole body from here. I loosen up my knee. And I give some movement. Okay, here now it's getting looser. Or I can add movement by using my arm. Okay, then after that I relax again and gradually remove my hand. Okay, now you look at, see how it goes. So now you see my finger, and you pay attention to the tightness. If you compare the tightness before, you might see a difference. Now it's kind of loose now. With light pressure, much lighter pressure than before, the skin sink in. That indicates the body get released. And if you use acupuncture needle, I'm going to show you acupuncture needles with non-insertion technique. So here I feel tightness. So before treatment, like this much tightness, tight like this. Then with this needle, I'm not inserting, just contacting. And from here, I rotate very fast. And I adjust my angle for according to her skin pattern. I keep rotating the needle very quickly, and I'm focusing on how I feel at the tip of my fingers. Okay, I'm gonna release my body. Okay, now see. Do you see it's looser than before? Okay, that's how I use acupuncture needle with contact needle. And you can treat other areas likewise. And if you pick up several points and treat that way, it can release the whole body, whole back, the area. And in that case, the body, like a bone structure, bony structure, lumbar vertebrae and sacral iliac joint and sacrum, and the pelvis bones move freely. That is the lower back pain.